good evening, everyone. Can you hear me okay? I want to welcome everyone to our graduation ceremony. My name is Jim Griffith, and I am the chair of the Department of Psychiatry and Behavioral Medicine at CAMC. Tonight, we're going to recognize three groups of graduates. Graduates that are completing their general psychiatry training program, graduates of our combined internal medicine psychiatry residency training program, and also graduates of our psychology internship program. You'll get to hear a little bit about each of our graduates from our program directors in just a few minutes. And then after we recognize our graduates, we also have some awards to pass out this evening, some of them to trainees, some of them to faculty. And following our graduation ceremony, there will be a reception just outside this room that I hope you will join us for. We have been training residents at CAMC for nearly 50 years now. The programs started in the mid to late 1970s, and we have gradually grown our program and now have over 20 residents in the program, nearly 30, and I'm very proud of that growth. We also have a great group of faculty that lead our department. I would like to ask all the faculty who are present to please stand. Thank you. These are the people that make our training program possible and make my job very easy. They are an outstanding group of clinicians, educators, researchers, mentors, and I couldn't do what I do without their leadership and their skills and abilities. And I feel very good when I have trainees in their hands. And they are the ones that, together with a lot of work from the trainees, are responsible for the product that we turn out. And I feel very confident in saying we turn out a good product from all three programs. You're going to hear about some of their accomplishments and also their destinations for where they're going to take the next step, and I think that will reinforce the notion that we turn out a highly competitive, highly sought after mental health professional from this residency program. I'm very proud of that. Okay. So with that, as an introduction, I'm going to turn it over to Dr. Sparks, who is our residency director for the general psychiatry program, to get the graduate recognition started.
Thank you. Can everybody hear me okay? All right. First up is Dr. Majid Al-Sayed. Majid came to us from the University of Damascus. When we met him, he had been doing research at the University of Chicago and had come to do a one-month observership under Dr. Hamzi. He has been highly decorated while here, winning the Outstanding Resident Student Educator Award and the Helping Hand Award. He was peer selected to the House Staff Council and to be the psychiatry representative for our last clinical learning environment visit. He was presented at the state and national level APA meetings and received the APA Diversity Leadership Fellowship. Majid is a mentor at the Doctor Mentorship Network. This provides underrepresented West Virginia University medical students with a mentor to assist them in navigating their transition to and through medical school. He also teaches a psychiatry review course each month to the students at the West Virginia School of Osteopathic Medicine prior to their clerkship. He has a great passion for academia. See, 5 minutes. I would love to see him remain in a university setting after training. Dr. Al-Sayed was chosen by his peers to be one of the co-chief residents for this academic year. He will begin an addiction psychiatry fellowship at Vanderbilt in July. Come on up.
know. Um, it's legit, has my name on it, CAMC and everything. How exciting. Good evening, everyone. Tomorrow marks 4 years since I moved to Charleston for residency. Little did I know how those years will shape me professionally, personally. It truly took an entire psych department, professionals, to get me here. For that, I have so many thanks. I owe so many thanks to so many people here. Dr. Sparks, Dr. Naza, thank you for seeing something in me, give me this opportunity. It's been amazing. I have to thank all our faculty, our staff, our nurses, both inpatient and outpatient. They dedicate their life in taking a new class every year, working with them till they graduate and get them ready for their life and adventure and career. My co-resident, I appreciate you very much. You made this journey very enjoyable. Thank you. I greatly appreciate my patients. They trusted me with their health, even when I barely had an idea what's going on, how to help them. They work with me throughout those years. I'm gonna miss them for sure. Shout out to Dr. Naza, Dr. Bo, Dr. Tager, aka Freddy, who show me that there's nothing impossible. I can achieve anything I can set my mind on. I really appreciate that very much, and I look up to you guys. Unfortunately, today I have my family here, which is that doesn't happen very often for international graduate. So I'm happy to have them here. My mom and my father and my sister. Hopefully, they are watching now. You gave everything to us. You put us first for my siblings and myself. Thank you for. Gosh, I'm blanking on words now. Thank you very much. I appreciate the love, the selflessness you guys put for us. I have my brother here who's been taking care of me, and since I was a kid, I don't have any words to express how much I appreciate him. I literally owe everything I am, I have achieved in my life to him. I have two of my cousins, Harith. We are 6 months apart. We've been through life together since we were kids. I appreciate you very much. I don't tell you or thank you enough for good reasons. But today is an exception. Thank you. Dawood, my cousin, I have to thank him. He's helping me moving next week, so here we go. My fellow graduates, their family, congratulations. This is awesome, and I cannot wait to see what life has for us. Thank you, everyone. Have a good evening.
Pull my notes back up. All right. Our next graduate is Dr. Samantha Condi. Originally from Kansas, Sammy came to us from St. George's University School of Medicine, where she was a member of the Gold Humanism Honor Society. By the time Dr. Condi ended her PG2 year, she had been elected by her peers as the Department Wellness Chair, had been faculty selected as a resident representative to the WVPA, had presented at the National APA meeting, and had won CAMC's Research Day. As a PG3, she was selected by the Chief Residents for the Helping Hand Award. And now in her final year, Dr. Condi has skillfully served as one of 2 Chief Residents, providing a compassionate voice for her colleagues, and has made my job much easier. Dr. Condi consistently scores over the 90th percentile on the annual in-service exam that we take, and has participated on our Mind Games team. She is reliable and trustworthy. As a cap on her residency career, she was given the Resident Recognition Award by the APA, and she was chosen by the Rappaport Fellowship Committee for the Apple Mentorship Program, and will begin a forensic fellowship at the University of South Carolina in July.
Good evening. My experiences as a VMI cadet, an athlete, and a medical student have shown me that my true passion and highest contribution to humanity is through psychiatry. Connecting with others through empathy and bringing light to those in the darkest hours. This was the closing statement of my personal statement for my application for residency. Today, with the completion of residency and the closing of this chapter, I am grateful to be provided with this opportunity to do just that, practice medicine at a deeper level through the field of psychiatry. As I reflect on my past experiences that have brought me here, I also reflect on many people who have supported me during this journey. I want to thank my husband, who is so supportive and has fiercely loved me through all this. I want to thank all my patients, all my friends, and all the faculty who have acted as mentors for me. And I want to thank my family for all their support as well. I also want to thank Dr. Sparks, Dr. Griffith, and Dr. Naza for always having an open door for me as well. And lastly, I want to thank all the residents for providing me the opportunity to serve as your chief resident as well. Thank you everyone for helping me become a better friend, resident, colleague, and human. Congratulations, everyone.
Next up is Dr. Jeffrey Niles. Jeff comes to us from the West Virginia School of Osteopathic Medicine. He started with us early, being chosen at the end of his third year of medical school for the Rural Scholars Program. And even prior to this, worked in CAMC's Clinical Resource Department as a nurse's aide and safety sitter. While in residency, he presented a case of olfactory hallucinations at the state APA meeting, participated on the Mind Games team, served as a quality improvement leader, and was a resident member of the Workplace Violence Committee. Jeff and I are both members of the Behavioral Medicine Book Club, and I can always count on him to have an interesting take on whatever we are reading. Dr. Niles was one of 2 residents over the last decade to complete a 4-block elective in dialectic behavioral therapy during his last year. Dr. Niles will be heading to Pittsburgh after graduation and will be an outpatient psychiatrist with Psychiatry.
All right. I'm going to be a minute. COVID was going on during my medical school graduation, so I have to make up for lost time on the thank yous. So first off, I'd like to thank my patients. They were amazing teachers, and I hope to continue to learn from them for the rest of my career. I would like to thank the office workers and nursing staff for their invaluable help serving our patients. I'd like to thank my attendings, both the psychologists and the psychiatrists, for all they taught me. I hope to carry forward the best things I learned from each of them when I practice. I'd like to thank my fellow residents. Nobody understands exactly what we go through in residency except for my fellow residents, and it was so validating to work alongside you, and it was just a great time. We survived residency, yay. I'd like to thank my aunts for coming down from Connecticut for my ceremony. I get my great sense of humor from them, and every smile I've ever gotten from a patient is definitely due in part to them, so thank you for coming. I'd like to thank my grandparents. They've always encouraged me to follow my dreams. I'd also like to thank especially my grandma Kathy. She was a psych nurse before she retired, and hearing how she helped her patients over the years really inspired me to pursue the field. I'd like to thank my stepdad for being very supportive throughout my education. I'd like to thank both my dad and mom for all the times we talked over the phone through the years, especially when things got hard. I especially want to thank my mom. She always inspired me to be a hard worker and to help people, and I wouldn't have been here today without her. And last but certainly not least, I would like to thank my fiance for all of his support. He's like an alchemist to me. He transformed my years in medical school and residency from what could have been the hardest years of my life into the best years of my life. Thank you all so much.
All right, I don't think I need a microphone, but it happened to be here, so. Good evening. My name is Hani Naza, and I have the honor of serving as the program director of the Internal Medicine and Psychiatry program here at Charleston Area Medical Center, Institute for Academic Medicine in West Virginia University, Charleston Division. I have been privileged to hold this position for the past 6 years. And the ideology of combined internal medicine and psychiatry training actually originated here in West Virginia in the late 1980s, with the first program starting at WVU Morgantown. A few years later, the second program was established here in Charleston, West Virginia, on the West Virginia University Charleston campus at CAMC. Although the Morgantown program has since closed, we proudly continue as the oldest continuously operating med-psych program in the nation and indeed in the world. We stand alongside 13 other med-psych programs at prestigious institutions such as Duke, Emory, UC Davis, MUSC, and the University of Iowa, to name a few. The mission of the Charleston Area Medical Center Internal Medicine and Psychiatry program is to train residents for board eligibility in both disciplines, internal medicine and psychiatry. Residents will be meeting requirements of both American Board of Internal Medicine and American Board of Psychiatry and Neurology. And they experience a holistic approach to patient care that encompasses both medical and psychiatric need. Aligned with the CMC mission of striving to provide the best care to each patient every day, our program features an integrated care model that serves patients within a 12-county primary service area, including many designated underserved areas in Appalachia. Our graduates hold esteemed academic positions worldwide, from Harvard University and Cleveland Clinic to University of North Carolina, WVU, UC Davis, and Charles Drew University in California. We boast addiction psychiatrists, internists, psychiatrists, hematologists, oncologists, infectious disease specialists, and sleep medicine specialists who serve the world through a holistic care approach. None of this would be possible without the support of CMC and WVU Charleston. Tonight, we gather to celebrate the graduation of two exceptional young physicians who embody the med-psych ideology. They are paragons of passion, scientific rigor, evidence-based practice, patient advocacy, and the power to heal and treat. Our first graduate this evening is Dr. Sarah Reed, an outstanding young physician with a profound love for medicine and psychiatry, patient care, teaching, and to her home state of West Virginia. Known for her exceptional teaching skills, infectious enthusiasm, organizational prowess, and healing touch, Dr. Reed has made a significant impact during her time with us. Raised to heal and help, she excels in managing complex cases and brings smile to even the most challenging situations. A graduate from West Virginia University School of Medicine, she completed her clinical years here at CMC, starting in internal medicine clerkship before moving to psychiatry. That was her destiny. She chose to join our training program and served as a med-psych co-chief resident. We are honored that she has decided to continue her journey in academic medicine with us at Charleston Area Medical Center Institute for Academic Medicine. Please join me in congratulating Dr. Sarah Reed.
for those kind words. Well, last year, I was told we were expected to say something at graduation, and like a good resident, I prepared last night. I would first like to acknowledge my cousin Brian. Through his paraplegia and bipolar disorder, he showed me how necessary it truly is to look at the whole patient, body and mind, leading to my interest in the field of med psych. It's hard to believe that residency is over, a constant uphill battle of long days over short years. I would not have made it through without my support system. Thanks to my parents for listening to me vent and validating me when I needed it most. To all of my family in Kaiser, my siblings, my nephews, my niece, and all of my family here in Charleston, my in-laws. To Katie for all the long talks over queso dip. To my cat Darcy, many of you know my cat Darcy, who always let me know when I was on too long of a shift and wasn't there to give her a snack at the exact moment that she wanted it. And of course, to my husband, always making sure I was fed on call days, always helping in times of crisis on the medical floor when my patients were crashing, but mostly always making me smile. Congratulations and good luck to the other graduates. It's been an honor getting to know each of you and work with you. To Ian, we made a ride or die pact at Match Day 2019. And it's been one hell of a ride, man. Thanks for all the memories. And I still think between the two of us, I'm the better driver of a boat. Thanks to all my mentors and teachers for the lessons in medicine and in life, and to all the patients I've had the privilege of learning from. To Dr. Naza, our fearless leader, for being the best program director we could ask for, always supportive, always happy, the true embodiment of this small little hypomania it takes to do med psych. And thanks to our coordinator, Cheryl, and the department for taking care of us, and Nikki, everyone in clinic, and for all of the hard work that goes into planning this graduation. Thank you.
Our next graduate is Dr. Ian Thistlethwaite, another exemplary young physician with deep-seated commitment to healing and community service. Renowned for his exceptional communication skills and expertise in treatment-resistant cases, Dr. Thistlethwaite handles challenging situations with confidence, resilience, and knowledge. A graduate of West Virginia University School of Medicine, where I first recognized his med-psych talent during my tenure as a medicine clerkship director, he chose our program to further his training. Dr. Thistlethwaite also served as a med-psych co-chief resident, demonstrating outstanding leadership. He now embarks on a journey to serve and heal across the country as a telepsychiatrist, bringing care to patients in their homes, even in the most remote areas of our beloved country. Please join me in congratulating Dr. Ian Thistlethwaite.
Wow. Well, Sarah's definitely the better resident because she at least prepared something last night. I guess what I want to say is the last 5 years have been nothing short of a long road to a very, very difficult journey, but well worth it. I think we've all said this before and felt this before. The days are long, but the weeks are very short. Sorry. I guess what I would really like to say is thank you to everybody who has been so supportive. Not just my family, but also friends, colleagues, and attendings. I do remember doing my clerkship, first doing psych and thinking, oh, maybe I could do that. And Dr. Griffith said, well, if you don't fail third year, you could probably make it as a psychiatrist.
I don't think I said that.
And then I did my medicine rotation with Dr. Naza after doing psych with him, and I said, well, maybe I could do med psych. And I've never looked back since then. Looking out to my friends and family, I want to say thank you to my mom and dad. Sorry. Especially my dad, who I've always looked to as a mentor and has been my inspiration to go to medicine and eventually psychiatry. So thank you, Dad. Thank you to my mom for always being supportive, to my sister, to my two grandmothers who are here today, to my lovely wife who was there during the longest days that you can imagine and was always supportive. My son who exploded like a nuclear bomb earlier had to leave, so he's not here, but he's in my thoughts. I want to say thank you to Dr. I want to say thank you to Dr. Rahman, who always taught me to have will, to Dr. Sparks, who always taught me to find a way, to Dr. Bowe, who always told me how to face a challenge, even one that seemed insurmountable, and to Dr. Griffith, who taught me patience, and it taught me to be perseverant and perseverant. I want to say thank you again to everybody, and Sarah, you can never drive me on a boat. Thank you all. If I've left anybody out, I apologize, but thank you all so much.
Can y'all hear me? All right. Before we celebrate our psychology internship graduates, I would like to take a moment to thank everyone who supported our psychology internship during this pivotal year of meaningful transition and growth for our program. On behalf of our psychology faculty team, I would like to express our gratitude to Dr. Griffith, Ms. Feldhaus, and Ms. Montgomery for their advocacy and support of our faculty and our programs during this time of change. I would also like to thank Dr. Knudsen and the IAM for their support and investment in our clinical training programs and our research and scholarship. And I'd like to extend our deepest appreciation and sincere thanks to our psychiatry and our med psychiatry faculty colleagues for your partnership and your dedication in helping us achieve our clinical, academic, and training program missions. So thank you all for your support. We are delighted now to celebrate the graduation of truly exceptional psychology interns. While each of the psychology faculty play an important role and enjoy the profound privilege of participating in the professional training during the course of the internship, each year, our graduates often work closely with individual faculty in their areas of specialty and develop an important and special mentorship and working relationship with them. This year, the certificates will be presented to our graduating interns by faculty who have played an especially important role in their training year. So when I call your names, please join me on the stage to receive your certificate. I will be inviting up both the graduate and an intern faculty who has worked very closely with them during the year. So first, we have Dr. Alexandra Convertino and Dr. Jess Lazier. You want to do the picture first? Sure.
Okay, it is my honor to present this graduation certificate to Dr. Lexi Convertino as she is graduating with a PhD from San Diego State University. During her time here in West Virginia, Dr. Convertino endeared herself to so many of us on the faculty and to her co-residents, of course. Lexi is brilliant, warm, witty, with the mind of a scientist. She's committed her career to those with eating disorder pathology, those who've experienced trauma, and to sexual minority populations. She's a fierce advocate for her patients and a dedicated and competent clinician. She said this week to me, "I desperately want to do right by my patients," and that is true. I always looked forward to our weekly meetings and to sharing space with Lexi. I will miss you dearly. We are so lucky to have walked alongside Lexi on this stage of her journey. So her next career move is really exciting. She's going to step into an assistant professor position at California State University. Another move across the country. What an adventure. Many congratulations.
So I did not prepare anything, I'm going to be honest. But I will say that, first of all, I want to thank my husband, who, yes, I have dragged across the country going on 3 times now. I very much appreciate your patience and love. I would like to say thank you to Dr. Luzier and Dr. Weisenmuller, who spent their entire year supervising me. For better or worse. And I very much appreciate them and their role in my development as a clinician and as a person. I'd also like to thank my lovely co-interns. I wouldn't have made it through this year without you, and all of you are very lovely people. And I look forward to seeing you as you go through your career and life. And I'd also like to thank the psychiatry faculty that worked with me on CNL. Y'all are a blast. I greatly appreciated it. As well as the other faculty, such as Dr. Keener and Dr. Kerr, who also had a hand in my training this year. And so I just want to say thank you so much for all of you. And this has been a wonderful year, and it's all I could have asked for and more. Thank you.
Next, I'd like to invite to the stage Dr. Charlotte Esplin and Dr. Laura Wilhelm.
I feel so lucky to be able to speak about Charlotte Esplin amid all the wonderful graduates. I will never forget working with Charlotte. I've actually never known personally a Charlotte in my life, and I will always associate that name with just being a wonderful person. So when I was thinking about what I want to say, for me, the C, Charlotte is caring and compassionate. She is so hardworking, attuned, and so willing to advocate for the people she cares about. Her resiliency in going through so many difficult things during the year will always be unforgettable to me. She is so level-headed. She is open to learning, tireless in getting things done in ways I can't even fathom, and just so talented and exceptional. I could tell you about her patients who got better in really striking ways while she's doing all sorts of research, presenting, and fully participating in any supervision meetings. It has just been such a delight to know you. And she will do amazing at Sam Houston University, where so many learners will benefit from her wisdom.
Good evening, everyone. I feel so many different emotions this evening. It was 1 year ago today, my family and I packed up a big, huge truck, and we drove across the country to a place where we didn't know a soul. And that was one of the scariest things I've ever done. But I did it because I thought this internship would be the capstone of my training and change who I was. And it has done that above and beyond what I expected. I am a different clinician, a different person, because of the patients I have met, my co-residents, both psychology and psychiatry. It has been so memorable. My supervisors have been amazing. Thank you to each one of you for listening to me every week, for teaching me, for letting me cry when I needed to cry. Thank you. And thank you to my husband, who gave up his career to come here and stayed home with our children, and has done more than his fair share of our family life for the last 6 years. I appreciate every one of you. I don't know how a place can feel like home so quickly, just having been here a year, and it hurts just as badly to leave. And that's because all of you. So thank you.
Next, I'd like to invite to the stage Dr. Cassidy Sandoval and Dr. Scott Fields.
All right, folks, I've got the honor to present that certificate to Dr. Cassidy Sandoval. She's graduating with a PhD from the Virginia Consortium Program in Clinical Psychology. And so during her year here in West Virginia, she absolutely crushed it, y'all. She's just got this blend of, like, she's just solid clinically. She loves research. She's such a naturally gifted teacher. And that all just kind of comes in one package. She was a trailblazer on her rotation with me. First of all, I've never wrote a book chapter with a psychology intern until now. I've also never had anybody take the bait to do an inpatient rotation at the Department of Family Medicine, and Cassidy stepped up and did that. And to say it went well would be an understatement, because they still ask when she's coming back. And I'm like, hey, I'm still here. But anyway, so she just has this unmatched passion for serving the underserved and for working with patients diagnosed with disordered eating. And also what I found out from the inpatient experiences, folks with chronic kinds of medical conditions. And so she's just did such a good job. I'm going to really miss our time on Friday afternoons, supervision, learning about all the cool things you did all week, and kind of getting to, I guess, get a glimpse into your clinical mind and how you do such great work. I'm also going to miss our conversations about that very exclusive club that she and I are in. It's called Sam's Club. I don't know if you guys have ever heard of it. I introduced her to the free OSC, which has been life-changing. I'm happy to report that she is going to stay in the mountains. So she's going to be going to Appalachian State University as an assistant professor, and I'm eager to hear how that goes and how much she crushes it in the rest of her professional career. So I'm really going to miss you. Congratulations.
Thank you all. It's been a blast. And woohoo! We're done. Congratulations to all of you, and I appreciate my family for being here tonight.
Next, I'd like to invite to the stage Dr. Brenna Williams and Dr. Patrick Kerr.
among the many privileges that go along with being a faculty member here. Had the privilege of working with Dr. Brenna Williams over the course of the past year. She came to our psychology internship program from the University of Louisville, and she came to us with a very strong foundation as a clinician, as a researcher, and as a teacher, even though she is still so early on in her career. Dr. Williams is part of a generation of graduate students that have had to overcome the myriad hurdles of the COVID era for psychologists in training, and those are not small hurdles. Despite these hurdles, Dr. Williams came to our program having already won awards for excellence in both clinical service as well as teaching, which is highly atypical for someone so early in their career to have that kind of recognition already. She continued that pattern of excellence the entire time that she was here. Dr. Williams' professional background has included providing treatment to a group of patients that many clinicians find to be challenging and stay away from, those with eating disorders. She continued that work, and exceptionally so, while here, while also committing herself to working with yet another group of patients that many clinicians find to be challenging through her work as a team member in our dialectical behavior therapy program for suicidal adults and adolescents. I had the privilege of supervising her in this program over the past year, and during this time I've seen her high caliber clinical skills across a variety of settings and situations. However, the one thing that's continued to stand out to me about Dr. Williams is the deep capacity she has for bringing compassion into her work. She brings that compassion not only into her clinical work with patients, but also into supporting her colleagues, and even into her teaching. Because of one of Dr. Williams' lectures provided to our department, just as an example, we're now changing the practice of how we evaluate food insecurity in our patients. That comes from Dr. Williams' deep empathy for human suffering. And clearly, that's the kind of thing that's going to affect anybody's welfare. We made that change because of Dr. Williams. Dr. Williams is going to return to Louisville as a postdoctoral fellow at the Louisville Center for Eating Disorders. We're going to miss her tremendously. I'll miss Thursday mornings, hearing about the tremendous work you've done with your patients. And your thank you card said you'll keep in touch. I hope that's true. Congratulations, Dr. Williams.
I also didn't prepare anything, but I heard my mom is watching, so hi, Mom. Thank you so much to everybody. I'm really going to miss it here. I'll just leave it at that. Thank you.
So the next portion of our program is our awards presentations. And but before we start with the awards in the program, I'm going to ask Dr. Naza to come back to the podium for a special award this evening.
Hi again. Actually, tonight is a very special night because we graduated two of our great med psychers ever that I've ever worked with. And also, it's a sad night because we're going to recognize one of our medicine and psychiatry faculty member that is departing our department and going to continue her journey in the same state that she came to and get trained. So I'm going to recognize Dr. Sarah Henley. Dr. Sarah Henley came to our department from Texas. And I can tell you her first day ever was with me on the inpatient unit. We had a patient who is admitted to the psychiatric unit, and he was having some chest pain. And Dr. Henley came to me and showed me the EKG, and she told me, I think he has second-degree block, Mobitz 2. And I think it was missed in the ER. I looked at it, and I was like, that is absolutely right. We transferred the patient to the other hospital and got a left heart cath, and actually she saved his life. So that day really showed me how Dr. Henley is a great internal medicine and psychiatry resident at that time. Then I saw an amazing physician that did internal medicine and psychiatry. She worked with us in the internal medicine and psychiatry program. She was the director of our outpatient services in psychiatry, and she helped me with the consult service, which is one of the busiest services in the whole hospital. This is when we provide psychiatric advices to medically admitted patients. It is very sad for us, but also I'm happy that Sarah is going to stay in town. She will definitely remain part of our program, but I thought that we need to really appreciate her tonight for what she did to our training program. I would love if she can come here and get this small little award. Actually, this award carries here a small little logo that I created a couple days ago for MedPsych. So I'm so proud of it.
Thank you, Dr. Naza, for that presentation. So the next part of the program is going to be awards presented first by our residency training director, Dr. Sparks.
Find the right program. There's one with the winners written on it. I would. I'll trade you. All right. First up, the first award for the night is the Esther McMahon Award. Dr. Esther McMahon, for whom this award is named, in the midst of her psychiatric residency at the WVU Department of Behavioral Medicine and Psychiatry, was diagnosed with cancer. Her courage and strength to finish her residency as she battled cancer amazed coworkers, friends, and doctors who treated her. When doctors suggest she take time off from her residency to enjoy the time she had left, Dr. McMahon refused. Through her courage, strength, and willpower not to give up, she graduated from our program and went on to join a private practice. Dr. McMahon passed away at the young age of 35. In her honor, each year faculty selects a resident who most demonstrates her indomitable spirit, tenacity, and strength of character. This year's winner is a PG3 resident, Dr. Ali Youssef. And he was supposed to be here, but I think he wasn't feeling great. Is he not here? Okay. All right. All right. Okay. I'm going to go on to the second award. This is the Martin Comer Resident Award for Excellence in Psychotherapy. Martin Comer is a professor emeritus at the CAMC Department of Behavioral Medicine and Psychiatry. He retired in 2018 after being professor and chair at the WVU Department of Behavioral Medicine and Psychiatry for more than 40 years. Dr. Comer dedicated his career to the education of psychiatry residents in the field of psychodynamic psychiatry. His clinical teachings promoted the biopsychosocial model in psychiatric practices and led to the training of psychodynamically informed physicians in the field of mental health. This award is intended to honor both the beloved physician, Martin Comer, and the resident who embodies his enthusiasm for the use of psychotherapeutic interventions across multiple clinical settings. This award is selected by faculty and presented to the senior resident who consistently delivers comprehensive patient care, employing a variety of therapeutic techniques across the inpatient, outpatient, and CL settings. And this year's winner is Dr. Samantha Condi.
Next, I'll ask Dr. Kerr to come to present our Resident Research Award.
So at this time each year, we recognize a resident who's gone well beyond the call of duty in their scholarly work by presenting them with the Outstanding Resident Researcher Award. And this award is chosen democratically. My faculty colleagues nominate residents whom they see conducting work that embodies the principles of excellence in research. And all faculty then vote on that nominee. So it's a competitive process with multiple residents being nominated. And I simply have the honor of being able to present the outcome of that process. This award is presented to residents who demonstrate such ambition, drive, and leadership in their scholarly work that they stand out from their peers. The award recognizes those residents whose contributions to the scientific literature are likely to endure and whose work will be impactful. In short, this award goes to residents who push themselves academically to make meaningful contributions to science, clinical practice, and to the world. Often, the recipients of this award are those whose scientific work will matter to society as a whole. Now, historically, after describing those criteria, I go on to describe the attributes and qualifications of the awardee without naming them until the end. And this year, we're going to do things a little bit differently. I'm going to start with naming the recipient of this award, and then we'll talk about how we got there. So this year, our Outstanding Resident Researcher Award will go to Dr. Charlotte Esplin. From the beginning of her training here, in addition to undertaking an ambitious clinical training plan, Dr. Esplin fully immersed herself in rigorous research as well. Early on, she began collaborating with one of our faculty colleagues, Dr. Luzier. Her line of research focused on fully understanding the experiences of physicians who are women and gender minorities, and the ways in which their careers and their quality of life are often harmed by discrimination. Dr. Esplin emerged not only as an excellent collaborator on this project, she also emerged as a genuine leader, really serving as the tip of the spear for conducting the analyses of the data that were necessary to answer the critical questions that this study was designed to answer. Ever the proponent of disseminating excellent science in the service of better policy, Dr. Esplin presented her research not once but twice over the course of the year, one of those presentations earning her an award for the presentation. And of course, she serves as first author on the publication stemming from her work. Now, most would have been satisfied with those accomplishments alone, especially in just a one-year residency. Dr. Esplin, however, took it upon herself, really took the responsibility to initiate yet another study during her year here. This time focused on better understanding the experiences of women living in rural areas who have recently given birth and the mental health outcomes of that unique population. Dr. Esplin has been willing to make all of the sacrifices necessary to truly conduct outstanding scientific work. We knew that she was excellent when she came here. She turned out to be phenomenal, and that certainly qualifies her to be our Outstanding Resident Researcher of the Year. Dr. Esplin?
Our next award for Outstanding Resident Student Educator will be presented by Dr. Naza.
All right. Well, I'm not going to read it from here. I guess you guys can read it. I can talk a little bit about this role. So education is why we're here. So pretty much we're physicians, but also we are educators. And I can tell you educating others is what physicians have done for years and years. And that start actually from the first day in medical school. Then when they move on to residency, they will be educator for medical students. And the award tonight is very special because it is, you know, a resident that really has lots of clinical work and lots of extracurricular activities to do. And in the same time, they are great teachers. And they actually take off their personal time to give to medical students. And this year's recipient of this award is a person who actually shined in all services that he worked in, and he shined with medical students. The way this award is chosen, the medical student will actually name the resident who they enjoyed working with. And the recipient of this year is Dr. Sunny.
I'm going to ask the chief residents to come up next to present the next award. So Majid and Sam.
Hello again. We are very excited to present this award. It was very difficult for the chiefs and I to try and decide who would win this award because many of our colleagues have just been very helpful and such team players. So the Helping Hand Award is given to the resident who demonstrates excellence in teamwork and allowing others to give a helping hand. Today we have chosen 2 different residents. So we'd like to congratulate Dr. Scott Irvin and Dr. Neha Agarwal.
Okay, for our next award, we're going to do things a little bit differently, and that is our Daniel Up the Grove Award, which is presented to a faculty member each year. And I believe we have a video presentation from a family member of Dr. Up the Grove that will, where we will learn the recipient of this award.
Thank you very much for asking me to give out the Daniel Up the Grove Award for Outstanding Teacher at the CAMC award ceremony this evening. And I'm very sorry not to be with you in person. I thought it might be helpful just to talk a little bit about who I am, introduce myself, about why giving out this award is so special to me, and I'm so honored to be able to do that. And then, of course, announce the awardee. So my name is Rachel Up the Grove, and I'm a psychiatrist. I'm an academic psychiatrist, professor of psychiatry and youth mental health at the University of Birmingham in the UK, and a visiting professor at Oxford University. My work is very much in the area of biological psychiatry, but I trained and completed my PhD with the lead supervisor being a psychologist in cognitive models of suicide and self-harm in early psychosis before becoming more and more involved in trials, experimental medicine studies, with the main aim of developing new treatments for early stages of schizophrenia. So I've been practicing as a psychiatrist in the UK since the late 1990s, and trained in medicine at the University of London before moving to Birmingham to complete my psychiatry residency, as it would be known in the States, PhD, and then developing an academic career. This award is so very special to me to give out because, of course, Daniel Upthegrove, the award is named after, was my father. As you can see from in the program, my dad died in 1979 when I was 10 years old, and shortly after my mother moved myself and my sister Linda to the UK, where her family was and where she was from, and I've never lived in the States since. Linda, also a very good teacher and very gifted musician, returned to the States a number of years ago and now lives in California. But obviously you don't need to be a psychiatrist to maybe understand why I pursued a career in psychiatry, and also was so driven to understand what the real sort of factors are, the environmental factors are that drive and lead to the development of severe mental illness. One of which would be childhood and environmental factors that we were exposed to, not as a result of early bereavement, but really witnessing the levels of deprivation you can see in some of the UK cities like Birmingham, which sometimes I think isn't too dissimilar to Charleston, just in terms of the intergenerational lack of opportunities that people face sometimes, and the challenges of overcoming that and really realising opportunities. So one of the tenets of my research is really understanding this, the role of the environment and the role of childhood trauma, deprivation on biological symptoms, biological systems such as the immune system and the development of severe mental illness. One of the things that we're doing, for example, are investigating inflammatory models of early psychosis, and a number of experimental medicine studies that might validate new targets for treatment. But I'm probably going into a little bit too much detail there. So coming back, as a practicing psychiatrist, as someone who's been involved both in research and teaching for most of my career, it's always a delight and an honour to be able to award prizes that are recognising excellence in teaching. And of course, this award means a very great deal to myself and my sister, and it was really a delight to hear that it was still being awarded every year. As you can read in the brochure, my father died after a very short but painful struggle with recurrent melanoma. But my memories of him and the department's memories of his life and his impact is very strong, and certainly I've always heard and felt that he was a very gifted psychiatrist, a very gifted teacher, and I think that the legacy that this award is still being given out so many years after his death is, I hope, testament to that. So the awardee this evening, I'm really sorry that I haven't been able to meet. I've read and heard quite a bit about their exceptional skills in supervision, in making trainees feel safe and contained, which is particularly challenging, I think, when we're first practicing, and also stretching trainees and residents in their practice in a way that feels safe and contained. So these are some of the things that I've read about the awardee, and I'm delighted to announce that the awardee is Laura Wilhelm. So Dr. Laura Wilhelm, congratulations, and thank you very much for really striving to improve patient care in Charleston and surrounding area, which is also a very sort of important area of my heart. So congratulations, Laura. I would hope one day to be able to give out the award in future years in person, but it's been a delight to join you even briefly virtually. And thank you very much for asking me to give out this award. It means a great deal. Thank you.
Dr. Sparks, I think you are up next.
All right. The next award is the T.O. Dickey Program Advocacy Award. T.O. Dickey was the program director at the Charleston Division of WVU Behavioral Medicine and Psychiatry for over 25 years. During that time, he consistently displayed an unwavering dedication to the enrichment of both the department and the education and training of residents. This award was created to both honor the physician beloved by all that work with him and to recognize those members of the department who exemplify his enthusiasm and steadfast advocacy for residents and the program. This award is selected by faculty, residents, and staff and awarded to anyone in the department who exhibits selflessness, hard work, and dedication in order to provide the best environment for residency training and patient care. And this year's recipient is Dr. Samantha Condi.
Before I talk about the consult liaison service, I just want to congratulate Dr. Laura Wilhelm. I can tell you when I was asked to start an addiction program, I did not have an addiction therapist. And one time, I was put in a situation where I need to do a group therapy. And I was so scared. And I thought, okay, what would Laura do? And I was like, okay, path to recovery, path to relapse. So I copied that. So that tells you how great Dr. Wilhelm in teaching. She was a great teacher for all of us that graduated from this program. It's very well deserved. All right, now we're going to talk about consult service. And I'm going to talk about the service and talk about Dr. Learfold that we named the award after. So consult service is one of the busiest services in any hospital in the world, and definitely in our hospital is no exception. It's one of the busiest services ever. It's called consult, then liaison, which is a French word of connecting things. So what we do every day, we connect patients and providers, nursing staff, patients. And also, we are the patient advocate, because pretty much if you see mental health, every time we see any psychiatric symptom, we say, okay, that's psychiatric, I'm not gonna go any further to evaluate the patient, which is absolutely wrong. So what we do in consult service, we tell them, no, this is not psychiatric till you do the following workup. So really our job is not only to treat patient, but also to make a distinction between is it psychiatric or medical, which if you believe or not, it is very common to have psychiatric illnesses as presentation for medical illnesses. And our service have, discovered lots of acute stroke, where people can move their four extremities, but people didn't know that it could be psychiatric and change in personality, for example. So really, this service is very important for any hospital system or any big hospital system. And so that's why we recognize the resident who does the best job in this service. And to be honest with you, this year was absolutely difficult because we have residents who are amazing in the way they communicated with patients, they communicated with faculty members, communicated with other physicians, social workers. They really made a big difference. Now, we named this award after Dr. Learfold, and we lost Dr. Learfold a couple years ago. And I can tell you, when I was an intern in medicine and psychiatry, came here in 2007, the first lecture that I really enjoyed in psychiatry was from Dr. Learfold. He was sick. He came to give us a lecture on a wheelchair. And he gave us one of the best lectures I've ever had in my life. It was about psychopharmacology. He was the director of consult service for years and years. Then he went to outpatient clinical practice. Dr. Learfold really not only, impressed me, he actually impressed everyone with his knowledge and dedication to teaching, and before that to consult service. He was an artist, not only a psychiatrist, which is a big thing in the psychiatry and the consult liaison world. So this year recipient of this award is someone who got another award tonight. The other award was for teaching. But consult service has lots of teaching, right? So the awardee of this year is Dr. Sunny again.
All right, we're almost to the finish line here. And I think you can sort of see what a wonderful group of folks we have in our department. Can you all hear me okay? Yeah. Okay. So I want to say a few words to the graduates before we wrap up tonight. You guys are ready to make the transition to the next step in your careers, to either continue learning or providing high-quality mental health care to our patients. But I would say that you are entering practice at a very challenging time, and your period of training, of course, has also been completed during a very difficult era. I don't think you need me to tell you that. National surveys continue to show ever-increasing rates of mental illness and drug addiction in our country. A recent survey indicates that an estimated 1 in 4 adults now has a mental illness. Another recent survey by Kaiser Permanente found that half of young adults and 1/3 of all adults felt anxiety some or all of the time. The same survey found that half of the families responding had someone in their family or their extended family that had a mental health crisis in 2023, either an overdose, an ER visit, a hospitalization, a suicide attempt, etc., an alarming result. Many factors have probably contributed to this, including a lingering effect of the pandemic, increasing social isolation, loneliness, an ongoing public health crisis, according to the U.S. Surgeon General, and mental health workforce shortages. According to the CDC, more than 13 million people in the United States contemplated suicide in 2023, and 1.3 million people attempted suicide. Unfortunately, nearly 50,000 people across the country completed suicide in the U.S. in 2023. That is a rate of 14 completed suicides per 100,000 population, which is the highest rate in the United States since 1941. And you may know that in 1941, World War II was underway, and the U.S. was getting ready to enter the fray of World War II in 1941. And the suicide rate last year was higher than any year since then. Unfortunately, 353 of those suicide deaths were West Virginians. There was also greater than 100,000 drug overdose deaths in the United States in 2023. 1,335 of those occurred in our state. A rate of 81 per 100,000 population, and by far the highest of all states in the United States by a large margin. So if some point during your training you felt busy or overwhelmed, I think these statistics will help confirm that, and they are rather sobering, but I think they reflect sort of the hard work that you've undertaken while you've been training here in West Virginia. This is an area with a high rate of mental illness and addiction, and a lack of providers, and also a high percentage of Medicaid patients, which is another factor which I wish to mention. West Virginia has the 4th highest percentage of its population insured by Medicaid. Roughly 25% of the population in West Virginia is insured by Medicaid. But only about 40% of practicing psychiatrists and a lower percentage of practicing psychologists accept patients on Medicaid. So another factor that has led to our residents being very busy. It's part of an access problem for our patients. Experts currently tell us there's presently a shortage of about 8,000 psychiatrists nationally, and about a similar number for psychologists. The current average wait time to see a mental health professional nationally is about 50 days. Greater than 50% of U.S. counties do not have a psychiatrist, and over half of practicing psychiatrists and psychologists are over the age of 55. Approximately 60% of practicing psychologists indicate they are not taking new patients. Based on demographic population changes anticipated in the future, government experts estimate a shortage of psychiatrists and psychologists will be around 40 to 50,000 by the time you guys are mid-career. It's currently 8,000. So if you think you're busy now, just wait. It's only going to get busier. There are several proposed solutions to the mental health provider shortage, including what we've done. We've expanded our training program. We used to take 3 residents a year. We're now up to taking 6 per year. We've expanded our psychology internship program also. We used to always take 3 interns. Now this year we're going to take 6. So we are expanding, and so are other training programs. Other things like online help, telepsychiatry, physician extenders such as mid-level providers, group approaches, and perhaps even artificial intelligence are being proposed as solutions to the mental health shortage of providers, but I doubt it will be enough. So if the trainees stop and think for a minute, as I mentioned earlier, you've spent your training in one of the areas of the U.S. with the highest percentage of folks with serious mental illness, and also an area with severe lack of mental health providers, particularly in our rural counties. I think it would be important for folks here to understand that the residents at CAMC have been and continue to be the emergency psychiatric providers for Charleston and surrounding areas, and they have been the entire time I have been here, which is a long time. And there's a couple other guys here who trained here a long time ago too who will attest to that. This is without the residents providing this service, there would not be emergency psychiatric services in the Charleston area. It is a tremendous service to our community. So on behalf of the hospital and our community, I want to thank you for your commitment and dedication to the provision of this essential care during your time training. Your training has been rigorous and demanding. You've seen a ton of patients. You don't need me to tell you that. But I'm also very confident that you're well trained and well prepared for the next step and to have a very successful future. You will be highly sought after for your skills, but I do worry about whether you're going to be able to help everyone who's going to be seeking your care. I am sincerely concerned about that, looking at the figures and some of the future prognostications. However, on behalf of the faculty, staff, Department of Behavioral Medicine and Psychiatry, I do want to congratulate you for reaching this milestone. I'd like the group to please join me in congratulating our graduates. That wraps it up. I hope everyone can stick around and join us for a reception in the foyer outside. Thank you for coming.